Well, hey there. Welcome to this week's episode. This season's interviews, I love them because they're all about breaking down walls and talking about taboo subjects that are often off the radar in most conversations that we have with our providers. And this week is no exception. We're exploring all the ways we can create the necessary space to own and talk about our mental health challenges. But this ain't your mom's mental health conversation. Join me for a next generation mental health convo with the incredible Dr. Shahana Alibhai, a TEDx speaker, a family physician, and a mental health expert. Now, Dr. Shahana, she's dedicated her career to improving mental health, particularly among our youth. And she's been featured in major outlets like CTV and Global. And her innovative program, Think Like a Doc, and her powerful TEDx talk, Emotional Literacy for Better Mental Health, they've made her insights highly sought after. So it's really a coup that we have her on the podcast. If you didn't feel that motherhood glow that you're supposed to feel the second your kid is born, if you struggled with sadness or anxiety about motherhood in postpartum, if you kept your feelings buried because you felt like every other mom seemed to have it all together while you were living the life of a swan, no sweat on the top, but paddling furiously underneath, and you did it all while battling IBD, you are going to love this episode of the Cheeky Podcast. Dr. Shahana and I, we delve into so many good topics. We talk about the importance of mental health across the life stages, from adolescence to postpartum and beyond. We talk about how prioritizing and finding the language to talk about mental health without guilt or shame is so crucial for our mental and physical health. We discuss that the truth about navigating these rarely talked about mental health struggles like postpartum anxiety and postpartum OCD. Who's talking about that, right? We talk about it. And when you're navigating those things, you're also navigating difficult illnesses like IBD. So it's like a double whammy. Dr. Shahana, she helps us find ways to break down the mental health barriers by addressing societal expectations and normalizing the real and often hidden experiences that so many of us have with motherhood. And we dive into the link between gut health and anxiety and how that can manifest differently in each of our lives. And then finally, we talk about practical tips for change. And Dr. Shahana emphasizes the big role that small shifts can make when we try to improve our diet as well as our mental state. Dr. Shahana also gets really candid in this interview. She shares her own personal experience with mental health struggles, both in her youth and also as a new mom. She brings such a unique perspective to this topic. I really love that we get into this because knowing that doctors struggle with their own challenges as well, I just love how she humanizes this concept. She humanizes doctors in that way. So whether you're a new mom, whether you have adolescents at home, or you're just looking for ways to better manage your mental health, this episode is packed with valuable insights. Please help me welcome Dr. Shahana Alibhai. Welcome, Dr. Shahana. I'm just so excited. I've really been looking forward to having this conversation with you because working with moms who have Crohn's, who have colitis, they're so busy taking care of themselves, taking care of their kids, that mental health, it just gets put on the back burner. It's not something that's really in the forefront of their mind. So having this conversation with you today, I think is really important. It's giving us permission to say, yes, we need to talk about this topic. So I'm really excited to dive in.
Oh, it's my pleasure. And you couldn't have started it better than using the word permission, because I remember looking at my husband in my postpartum journey and just asking him for exactly that. I need permission to pause. Give me permission to take a break. Give me permission to take a step back. And ironically enough, I thought maternity leave would be a pause. And anybody who's listening, it's anything but that. So what a wonderful way to start.
Yeah, you're exactly right. It is anything but. And I know that something that is really near and dear to your heart is talking about postpartum anxiety.
Mm.
And this is something that many of my clients, my community, I know that they have experience with. Whether they're able to put a name to it or not, it's something that is really so much a part of their life. And so I find it interesting because I think nowadays we're talking a lot about postpartum issues. It's not something that was ever talked about in my generation, this before, during, after, thinking about your mental health in any way. And so, especially because of celebrities, they're talking about postpartum depression a lot. But the one thing that I think about this is that when it comes to postpartum anxiety, I'm not hearing that. I'm not hearing those words, right? Postpartum depression, yes. Postpartum anxiety, no. So I thought we would just start there. Can you tell us what is postpartum anxiety, and why is it just not in mainstream conversation?
Yeah, that's such a good question, too. And I think even if I think back to conversations with my mom during the postpartum period, it was often really misunderstood because it was, well, you don't feel sad. So what's the problem, right? We define this idea, if we go back to the nomenclature of postpartum depression, must be that you're sad, you're crying all the time, you're not getting out of bed, you're wearing, just your sweatpants, which is very common in motherhood, let's be honest, like, all the time too, right? So then what does that flip side look like? And you can think of postpartum anxiety and depression under mood disorders. So I always like to tell my patients, because I'll always say, doc, give me the anti-anxiety, not the antidepressant. Give me the anti-anxiety. And I'm like, surprise, surprise, it's the same pill. They're the same
Yeah.
thing. It's just different dosages too. So if we think of them as two sides of the same coin under the umbrella of mood disorders, I think postpartum depression has gotten more of a voice, potentially because postpartum baby blues, which is very different and secondary to hormonal changes right after the delivery, affects about 80% of women. So that's very common. And then roll into postpartum depression, which, can be, 1 in 10, 2 in 10. And that's just at the low end, Postpartum anxiety, however, is less recognizable. And I think that's why it doesn't get as much attention. It's less visible. It's the hypervigilant mom. It's the mom, and this can come in all sorts of flavors. It's the mom who's can't go to sleep at night, even though the baby is asleep, because they're so worried about sudden infant death syndrome. It's a mom who can't walk down the stairs with their child because they think they might trip and fall and some harm would come to the child too. It's the mom who, and we can go on, but vigilance is a good word. Vigilance or hypervigilance,
Hypervigilance. Yeah.
being extremely, that your arousal system has gone on to above in the next level. One of the, what we call the DSM-5 criteria, or this idea of what does psychiatry look like? What does that manual look like? Part of anxiety is this idea that you're keyed up, you're on edge, you're restless, the inability to relax, the inability to sit still. So it might just look like you're mumming it. You're constant, and you just look like a mum, because which mum isn't sitting still? Like, you're always doing something. But I think the distinction we have to make is, when you have any sort of mood disorder, it interferes with the quality of your life. This is not just like, you're getting some extra cleaning done or you're feeling really hypervigilant. It's the idea that you can't go out in public. You can't complete your duties that you want to do. You're not completing self-care, or it's affecting your physicality. You're not eating well. You're not sleeping well. You're not engaging socially, all of those types of things. So is it affecting your quality in your day-to-day level of functioning? The one caveat to put into all of that is, even, we were just talking about this, off the air, this idea that IBD in general, we're talking about a stigmatized topic, but let's add to another stigmatized topic, not postpartum anxiety, but postpartum OCD. It used to fall under the umbrella of anxiety. It doesn't quite anymore. But the idea is that postpartum OCD can often misrepresent as anxiety. You see the woman that they're super anxious and scared and not sleeping at night, and you think it's just because they just want to protect the baby. But we don't ask that second question. And the second question is that woman is afraid of causing harm to their child. And they actually think that they could cause harm. They don't want to by any means, but they're so deathly afraid of that. That is what
And
we
you're
call
saying that's where it crosses over
that's
into OCD versus
exactly.
anxiety?
Exactly.
Yeah,
So
okay,
the
gotcha.
trick and the hard part, once again, not recognizable, is that when we think of OCD in pop culture, we think of the actors or actresses that are checking the doorknobs or wiping or washing their hands 100 times. With
What is that movie with Jack Nicholson? Do you know what
oh
I'm
yes,
talking
I know what
about?
you're talking about. Yes,
He had OC that's a long time ago. That's showing my age.
no,
But
no,
yes,
but I
that's
know
what we think about.
that's what you
We
think
think
about.
about the compulsions
Exactly.
when it may not be compulsions, right?
It's
It could
it's
just
a
be the thoughts.
It's just the intrusive thoughts. The intrusive thoughts dominate the story and dominate the picture when it comes to postpartum. That's why these poor women, including myself, your partners, your family don't recognize any compulsions. The compulsions can be the waiting by the baby's bedroom because you're so worried that something's going to happen to them, hiding all the knives in the house, refusing to bathe the child, all these things that could get swept under the rug too. And we have to put words to this because when my eldest is now 8, this is now 8 years ago, I found out about this through a tiny subset on a blog. And here I am, a physician. This is what I deal with. I knew in my heart what it was, but I really didn't want to open my eyes to it. I looked at my husband. I'm like, why can't it be my thyroid? Why can't it be my iron? Like, give me
Right,
something
right.
like that. Like,
Give
this
me
is
something simpler.
something simple. Like this, the shame, the
And without the stigma.
completely. Like, I'm going to
Yes.
pick up the phone and tell my doctor, yes, I'm having intrusive thoughts about hurting my child. Like, are you kidding me? No way. But this is why it's so important, because we're losing women. We're literally, the rates of suicide can be so high because of the stigma and because of the misdiagnosis of postpartum psychosis, which is a
Wow.
completely different kettle of fish. And that's much more rare. It's still there, much more rare. But you can imagine what a misdiagnosis and an error in treating them in terms of medication could do. So that's why I like to just spell it out, because if someone listening can hear, recognize, help anybody else, then we've saved that one person.
Yeah, absolutely. And I know that this is something that you have had to deal with in your own life, like you alluded to a little bit after, I don't know, was it the birth of your first child
First,
or
yeah,
it was the birth of your first child.
yeah.
It was postpartum OCD.
OCD, yeah, yeah. And
Can you share with us a little bit about your story, about what that journey was like for you?
yeah, for sure. I think it's ironic now that I think back, it's almost like how could it have not happened? Because one of the things you have to realize that if you go into the postpartum or perinatal time period, the time period surrounding, conception to postpartum, with a mood disorder of any sort, that's a risk factor for having postpartum anxiety, depression. So if I already have
Sure.
that history, after the postpartum period is a beautiful, fertile time for these things to rear their ugly head. Unbeknownst to me, at the age of 4 or 5, I started having symptoms of what's called pure obsessional OCD. Just the intrusive thoughts, not so much the compulsions. And that's much more rare in the whole grand scheme of things. Remember in
Is
the
that something you're looking back on and saying in hindsight, right? Because you're at 4 and 5 years old. Are you remembering back that? Are you thinking, oh, in hindsight, I think I was like this pretty much most of my life?
good question. No, it was vivid, troubling memories
Wow.
of that
Okay.
time. Extremely troubling memories. So much so I would pull my mom aside, try in my, elementary school way of conveying what was happening, but it was taking the word distress and bolding and underlying it and feeling so much distress at what was going on, but not having the language or the maturity to explain what was going on. And I think when there's a
This is the pure, oh, go ahead. I was just,
sure,
well, let me just say, this is the pure definition of what you were talking about earlier, where it will affect the quality of your
yes,
life.
oh,
And so it's so memorable for you because it affected the quality of your life so much, even at that very young age.
absolutely. Absolutely. I think I have a lot of people right now, talking about ADHD, and they'll say, oh, yeah, I remember that time where I got a bit distracted. This was kind of the counter to that. This was a constant memory for me that kind of ebbed and flowed, but it was always smoldering under the surface. And surprise, surprise, during stressful times, it got worse. What made it better? School. School made it a
Hmm.
lot better because I had something to focus my brain on, right? Summertime was the worst for me because there was nothing like that hamster wheel to keep chasing, too. So, ironically enough, well, medical school entered the picture, and that turned out to be a beautiful cure, didn't it? Because it kept that part of my brain so completely occupied, all with the feeling that I felt that something was wrong, something was flawed, but I didn't know exactly what. So you're lurking in the shadows, right?
Gotcha.
And I remember we all have to do all the rotations, whether it be obstetrics or internal medicine. And of course, psychiatry is one of the rotations. And there was two charts, one with a lady with bipolar and another with a lady who was a professional. I still remember she was a lawyer and she had OCD, but more pure obsessional OCD. And I gave the chart of that to my friend. I said, you take her, I'll take the bipolar patient, because I couldn't be anywhere near that diagnosis I
Oh,
was skirting around. It
interesting.
was too close.
Interesting.
I'm not going to be you. I'm going to separate myself from you. And all that separation did was create a springboard for me to land face first into that diagnosis. Now not called pure obsessional OCD, but postpartum OCD. So that it's the same flavor. It's just the fact that it got much, much worse. You add sleep deprivation, hormonal changes, and a predisposition too. So and that's and even after all that too, it took me a year to reach out for help. A full year. A full year.
So you were experiencing this postpartum for about a year before you said, you know what? Something's really not right here. I need to do something about it.
Oh, absolutely. It was coming face to face with all of the things that I talk to my patients about. Isn't it funny how we expect our patients to sit there, be vulnerable, tell us the truth, tell us how they feel. But when we're asked to do that, we lie, we numb it, we suppress it, we do all of these things to sugarcoat it. And that's exactly what I did
Hmm.
until I couldn't anymore, until the thought of me not being there was actually a comforting thought. And that was the line. And even though that's the subject matter that I deal with so often in my practice, especially dealing with youth, it was that a rude awakening that how can I not recognize this in myself? But it certainly took its sweet time. It took a year or two. And even after that, I didn't have the courage to call my own family doctor. We were friends, we were colleagues. It was too close. So speaking to an anonymous physician helpline, I remember the phone call, I told my story and they said, you're going to have to speak to a psychiatrist. And you're going to have to go on medication, right? And I said, you know what? This has been so therapeutic. I feel so much better after this phone call. No. So
Oh,
it speaks to the vulnerability of what does being a patient look like? And just because the doctor tells you that this medication to take doesn't mean it's going to work, right?
right.
Like you have,
Right.
and mine didn't work the first time, the second or
Okay.
third time. And I think I'm trying to pull it back to, women with IBD as well. I have a sister who had IBD and now has a total colectomy. But at the same time, I look at my patients sometimes and say, I hate that you have to be a guinea pig. I wish I had a crystal ball and knew that this was the exact right medication for you. This was the exact right dose. But it's the hardest when you're the most vulnerable and you have to go through that as well. And I think we have to kind of call it out sometimes, and that's okay.
Yeah, yeah.
You
Well,
know?
I don't know that a lot of doctors do that, so
No.
I'm glad that you make a practice of doing that in your practice, because I feel like a guinea pig so often. Well, we don't really know if this works. We're not really sure, but let's try it, right?
Right,
And so,
exactly.
yeah.
And yeah, and I think until you're put in that shoes of, oh, like who wants to actually take a foreign pill and put it in their body? Like you have to be at a certain level to say things
Yes.
are not good. Things are, and I remember taking the medication and looking at my kids, and I'm doing this for you guys. I'm doing this to be here, to be present. But it taught me a lot about the flip side of things. All right. I always say it's easy for me to sign the bottom of a prescription, but when my name was on the top, things got real.
Yeah, it's probably, I would imagine, the hardest
Yeah.
for an MD, a doctor, to
Yeah.
then go to their own doctor and admit, something that's going on with them, especially when it comes to mental health.
Oh,
So, what courage that you had to, to take that step and
no,
say, you
thank
know
you.
what, I need
Yeah.
help.
Yeah, no, exactly. And I think it's so interesting because I think there's a reason why certain support groups who advocate a sense of community, that's why they work. Because I think anything bred in the shadows is where all of this stigma festers. The minute I started to use the words, I remember the first time a podcast host asked me, said, oh, was it postpartum depression, anxiety? I couldn't say the words OCD. It took me years, just recently, actually, just over the
Uh-huh.
last couple of years. I still am not at a place where I could go to a family gathering and say that. None of my close family really knows. None of my, no. So
Wow.
it's much
Yeah.
easier to speak to strangers in some ways, but I'm doing this because, once again, if somebody listens to this, the rates now are not thought to be so low. In fact, up to 50% of postpartum women in one study for the first 6 months were shown to have intrusive thoughts. So it's wild, right? It's much
So
more
much
common.
more common than we realize.
Exactly,
Yeah.
exactly.
Yeah.
Yeah.
And when we keep it in the shadows and we don't talk about it, the problem gets worse and worse. And
Yes,
like you said, suicide rates, thinking about suicide, that kind of thing
exactly.
it's high.
It's high. It's
Yeah.
high, right?
Yeah.
Exactly.
Just a quick interruption. We will get back to the podcast in a second. I'm wondering, are you like many of us with Crohn's and colitis? You're turning to food to help heal your gut, but you're just feeling really overwhelmed by the myriad of gut healing diets out there. There's gluten-free and dairy-free and paleo gaps, and it can be really confusing and frustrating and leave you feeling disheartened about which diet is the right one for you. And I've been there myself. That's why I created the Ultimate IBD Diet Decoder Quiz to help you find your best diet for your unique needs. Now, maybe you've tried one of these diets, but you gave up quickly because they were just too strict or they didn't fit with your lifestyle. Here's the truth. There is no one size fits all diet, but there is one best diet for you. And the best diet for you isn't just about your symptoms, it's about your lifestyle and your personality too. Are you ready to find the gut healing diet that fits you like a glove? Head on over to KarenHaley.com/quiz to take my ultimate IBD diet decoder quiz. It's free and it only takes 3 minutes. Discover what you've been meant to be eating to put your IBD in its place. That's KarenHaley.com/quiz. And now back to the show. I want to stay on the topic of postpartum issues for a minute. So, as a new mom, at our society, you're told, well, as soon as that baby's born, you are just going to love it. You're going to bond with it. Immediately after birth, you're going to have this connection. So, what do you do if really, you're dealing with postpartum mental health issues, whether they are depression, anxiety, and especially for somebody with IBD, because not only might that be an issue, but having a flare up right after birth, post birth, right, is very common. So even if it's just that I'm dealing with so much of my own flare up and my own gut struggles that I just cannot find the bandwidth to bond with this baby, what are some steps that you can take when this is just all encompassing for you?
And you said it best too, because it really comes down to expectation management. I use this analogy of the stress equation. Really, is stress wanting or expecting things to be different than they are? When there's a discrepancy between, let's take my wedding day. My wedding day has to be, everything has to be absolutely perfect, and the sun has to be shining, and everyone has to be smiling, and whatever the case might be. And a couple drops of rainfall, suddenly there's that gap. And it's about managing the gap. And you manage the gap by managing your expectations. It's nothing to do with your effort. You still put all the effort into planning that perfect wedding day. But if something that goes wrong out of your control, like a flare up, for example, like mental health, notice I use the word out of your control. Because we have this, if I right now had an IBD flare up and I had a mental health issue, which one am I going to get more support from? Which one am I going to say, okay, here, I've got your back. I'm hoping it's both, but it's not usually.
It's
not usually.
And even if there are people that are willing to, if I reached out and said, I need your help, as the IBD patient, you're going to put your time and effort into the IBD because you feel like I have to take care of my physical health first.
Yes.
My mental health is going to take the back seat.
Absolutely.
And we do this time and time again.
Absolutely. And I think it's very quantitative. Like, look, even with IBD, from my sister's experience, you might measure it as, the number of bowel movements, how much abdominal pain you're having, the quantity of bleeding. You have something to hang your hat on. For mental health, it can be really difficult. It can be really nebulous. Is it what does concrete look like for mental health? And you
Yeah.
know what the other misnomer is that we think that mental health is either really anxious, keyed up, or it's sad. And sometimes it's none of those. Sometimes it's nothing. You feel absolutely nothing. It's that lack of feeling. It's that numbness. It's that cognitive blunting. And especially when you have that, that's even harder to quantify because you go around feeling like a zombie. And unfortunately, some of the medications titrated to the too high of a dose or the incorrect dose can also cause cognitive blunting. So you have this double-edged sword. But going back to your initial question, I think it really comes down to putting a pin in this idea that we have a certain amount of time, a finite amount of time to bond with our child. I'll have to be honest, I didn't feel a sense of bonding with my first child for months. For months.
Mm-hmm.
It's going to make me emotional now, but I remember going down to his level and crying and crying and looking at him and apologizing. And
Oh,
he was 6 months, 7 months old, just kind of sitting there and just bawling, going, "Mommy's so sorry. Mommy's so sorry. Mommy's so sorry." I have to put this in there though. Do our spouses and partners feel the same way? I think there is a society's expectation that we go through this pregnancy, which can be beautiful and burdensome and all of that at the same time, and the delivery, which can be also difficult. And
yeah.
then suddenly we're meant to just milk come in, breastfeed over the sunset, and bond at the same time. Let's manage our expectations. And I think what we have to realize is that, this baby is going to be in your life for the long term. You guys, you're always going to be its mother. You're always going to be whatever role you happen to play in its life too. So let's take that pressure out a little bit and be kind to yourself. Because I think the minute you say, it's almost like, don't think of a pink elephant, you're going to think of a pink elephant. It's going to happen, right? So
Yeah.
I think there's a society and gender expectation that we have to start tweaking a little bit more.
Yes, amen to
Yeah.
that. And I hope that this is happening slowly. I do
Mhm.
hear more people talking about it. It's wonderful that you make this so central to your
Yeah.
message because we just need to have, again, I have to go back to that word permission.
Yes.
As women, we have to give ourselves permission, and that comes from normalizing, from
Yes.
knowing other people that have gone through it.
Exactly. It,
When I had my third child, you mentioned that numb feeling, and I had that feeling for a really long time. And I would also add a fog. Like I was just in a fog.
yeah.
And I didn't realize it. So this is another piece of this. So sometimes you'll realize it and you just don't know what to do about it, or you don't want to do something about it because of the stigma. I didn't realize until my child was a year old,
Yeah.
as the fog started to lift, the numbness started to lift, that I said to myself, "Oh my gosh, Karen, you actually had postpartum depression." And you didn't know it the whole time. I didn't even know, like I was so numb,
Yes.
I didn't even know it. It wasn't until I started to experience joy again
Yes.
that I said, "Huh." I was not in my right mind for a
No.
year, and I didn't even know it.
Absolutely. And at that time, you would have had probably a 7 and 8 year old. Like, you'd have had,
Yes,
you're having two other kids dealing with a
that's right.
child. Like, I think motherhood shows us the impact of sleep. If anything, it is hard. It is really,
Yes.
really hard. And I think the same thing, our marriages are not supposed to be all bliss, and otherwise it wouldn't be real, right? And our relationship and our bonding experience with our children, let the good things come. There's lots of good things to come. And any of us moms now, my kids we talked about 4, 6, and 8. I look at them now and go, oh my word, I feel so much more connected with you than just feeling like a milk machine all the time. But
Of course.
but who's going to go up to a mom and baby group and see all these doting parents and say, I don't feel connected? Like, you feel like the black sheep, right? So just hearing it from someone like us, that this is normal and you're not alone.
It just takes one person to say, "Yes,
Yeah.
me too."
Me
Right?
too. Exactly.
Yes, exactly. And I know in your practice, we haven't actually talked much about your practice. I've already said your bio, so people have heard about it, but I know your practice is in British Columbia. I know you work with teenagers. That is it 14 to 24? Do I
12
have
to
that age right?
25. Yeah. Yeah.
12 to 25,
Yeah.
something in there. And so you probably see a lot of kids with anxiety.
Mm-hmm.
So obviously anxiety and gut health, they go
Yes.
hand in hand.
Yes.
Is
Yes.
that something that you see in your practice when people come into you and there's anxiety issues? Do you also notice a gut component?
Oh, I can't even. So glad you brought that up. And I think just in general, I'm noticing more gut issues, like so
Mm.
many more gut issues. You really ask these kids about their digestion, not that they want to be asked, but I will ask them.
Right.
And I'm appalled at what they think normal is. I'm appalled at
Right.
what they think normal is. And you go back and you look at, just like when you think about burnout, for example, you can't just blame the individual. You have to look at the systems behind the individual. The same thing here when it comes to the care of our youth. You have to look at the systems behind our youth. And so many of these youth, I had a conversation. She's like, my mom can either afford, things are really tough here right now, especially in British Columbia with inflation and whatnot, and the cost of food prices and groceries and fresh fruits and vegetables going up. She's like, we can either afford rent or fresh fruits and vegetables. Like that's where
What are you going to pick?
what are you
Right.
gonna pick? She
Yeah.
comes to me and she's like, it was so endearing. She's like, my favorite food. I said, what's your favorite? I was thinking pizza, cauliflower. She's like, I really love cauliflower, but my mom,
Wow.
she's like, I open the fridge and all there is processed food. Processed food. So
It's cheaper. Well, at least in the States. Probably in Canada too, I would guess.
Oh, absolutely. It
Yeah.
lasts for longer. You don't have to go grocery shopping as often. It's frozen. It's right there and then, and it's easier to prepare. It doesn't involve it, so many different reasons. And then and then it's so easy to say, oh, I blame the parents. It doesn't take long to look at their history and their background. So this intergenerational trauma, if I dare say that too, I think affects the systems around things, affects our nutrition, and that directly affects our mental health. There is a connection between the two. Like it's 2023, we have to say that is a well known fact. So, for me, I love to talk about fish oil with the youth that I work with, but so much of it comes down to cost and accessibility, right? We can't even afford medications, let alone, supplements. So we try to just focus on the basics here. Can we cut out a really easy one that I do is that what are you drinking that contains sugar in it? Like can
Okay.
we just change to water?
Start small. Right.
Super small, right? Can you not eat something out of a package at breakfast time? Like, can we do something like that? I work at a school that's kind of an at-risk school with kids who have been kicked out of the regular school system, and they provide a hot lunch. So in some ways, they have one meal every day that is freshly prepared, which is lovely, right? So those kids have access to that.
Yeah.
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 I just like you're doing with starting small, this is what I do as well with people who have IBD and we're starting to make dietary changes. It's baby steps.
Yeah.
You don't need to make a massive diet change and you don't have to do it all at once. Let's just start by like removing some of the sugar,
Yes.
right? It's that simple. So no matter what you're dealing with,
Yes.
right? And then when you do these things and let's say, I know it's probably difficult with compliance, but when you do these things and somebody is compliant that you're working with, do you notice that it impacts their anxiety levels?
No, it certainly can. I think I keep telling them and teaching them that, food is medicine, right? You
Right.
have, energy drinks are just abundant amongst our youth these days. It's so interesting. I'll ask about coffee. They'll be like, not as much, but how many Red Bulls or whatever monster drinks or whatever they call it these days? Oh yeah, tons of those. Like they don't equate it. Just like I say, are you smoking cigarettes? Oh, not cigarettes, but are you vaping? Oh yeah. Like,
Right.
the nomenclature.
You have to ask the right question.
And the nomenclature is different. But yeah, absolutely. They can see small, maybe it's a little bit of an improved sleep. Maybe it's that they're not as fidgety anymore. Maybe it's that they're not craving certain things. And once again, small, it's small and might notice small things, but those small things build up.
Yeah, exactly. Yeah. I'm thinking about this idea of anxiety.
Yeah.
And of course, that goes along with perfectionism,
Yes.
right?
Yes.
That kind of thing. So especially in new motherhood,
Mhm.
it's almost normal, right? You've prepared for this for 9 months. You've read all the what to expecting in all these books, and you want to do it right. I'm doing this in air quotes if you
Yes.
can't see me.
Yes.
You want to do it right. So can you talk to us about what's a healthy way to approach this in terms of this perfectionism, anxiety, stress? Like, when does it cross the line
Yeah.
into this is now pathological?
Yes.
What signs should we be looking for besides I know you mentioned, when it's impacting the quality of your life? Is there anything else, like, just like tangible, that we can say, all right, this is I've gone beyond,
Yeah. Yeah.
right?
Yeah.
I know I'm a new mom, and like for me, for example, when I had my first son, we were pretty rigid,
Yeah.
and so he had to eat at the same time every day. But
Mhm.
if it was noon and I did not have the food on the table for this baby, I was like, we need, like, Dr. Shahana, this is what we would do. We would actually stop the car. We were driving in the car. We would stop and say, okay, it's noon. We have to stop because he has to eat. And I'm not talking about breastfeeding. I'm talking about when he was even eating table food. He has to eat. Like, that's pretty rigid, right?
Yes.
But
Yes.
that was probably that was probably the only thing. So when does it like cross over into,
Yeah.
okay, like, this is too much?
Exactly. There's a beautiful analogy given where you can imagine a river, and on one side of the riverbank is chaos, and on the other side is rigidity. And part of motherhood, I think, is flowing between both, right? And it's not that you're ever going to be beautifully downstream, right smack dab in the middle. It's being able to ebb and flow and change directions and change the tide when you need to. And that's the complete opposite of rigidity. But I think the way to distill that down is to ask yourself the question, what does that say about you? Why do you need to feed him directly at noon? So you would maybe you'd say, well, it's really important for his growth. Well, tell me, why is it really important for his growth? Well, I'm afraid that he's going to lose weight. Well, why are you afraid that he's going to lose weight? Well, my mother-in-law's been telling me that he's not really looking as chunky as he used to, and I really want to make sure that he's looking that way. You keep asking yourself that same question. Whatever I answered was completely theoretical, but about 7 times. And you do that 7 times
Oh, I
to
love
get to
that.
that root. And the root, I give the funnel. Any new mom with young kids would know that we love pouring sand through funnels, right? You funnel things through, pouring water or whatnot. So imagine you have all of that milieu of stuff in your brain of, why you are, and it might be the behavior that you're funneling through. You might not know what that, you were adapt to saying, okay, it's the rigidity, but you might just know that this is my behavior that I'm doing. I was the same way with my first. I think many of us are, because we don't know what we're doing. So you
Right.
clamp down and try to do everything too. I remember with my first, I had a birth plan that I always joke is not, photocopied, but laminated. Like this is the way it was going to go. And within 72 hours, everything went out the window, right? But at the end of that funnel, you want, if you can, come down to fear. Like, what is that fear? Is it fear of failure? Is it fear of rejection? Is it fear of the unknown? Is it fear of being hurt? There's, about 9 or 10 cardinal fears that we all have to some degree. And I'll just cut to the punchline. For me, so much of my rigid behavior was because of feeling like I was going to fail as a mom. And for me, there was nothing worse. And it goes back to that expectation management, because I had set motherhood on the highest pedestal. Throughout medical school, everybody would say, I want to be an ophthalmologist. I want to be a dermatologist. And I would say, I want to be a mom. Like, that's going to be it was mom, mom, mom. And secretly, I think it's because I wanted a break. Like, I just thought maternity leave was going to be this beautiful strap on your apron, bake some cookies, everything's going to be okay. I was tired.
You're
And
in the rat race and you just needed a break.
well, exactly.
And you thought motherhood was going to give you that break.
Well, and
Yeah.
society made it look that way. You kind
Of
of
course,
baby
yes.
bump. You and I'm not being facetious at all, but my own mom, she'll laugh at this, but like our home videos had music playing in the background. It looked lovely. So I always joked to her. I said, "You did not portray this correctly to me. It's false advertising." But at the end of the day, too, so the higher you set that expectation that it is going to look and feel and act a certain way, your baby hasn't read what to expect when you're expecting. And any of us with more than one child, very rarely will we say, oh, he or she is exactly like your brother. Oftentimes it's like, wow, I thought I knew what I was doing. And then I'm completely
Curveball with the next one.
right?
Yeah, they're all so different.
They're all so different, right? So you can, but for most of us, I think it's the fear of failing at this thing that society tells us that we right from delivery, listen to your body, be intuitive. Our grandmothers and great grandmothers. And I remember thinking, I don't know what my intuition is telling me right now, because we're so afraid and confused. And it's okay to be. It's okay to be. So I think this higher expectation of having it all go a certain way doesn't allow us that feeling of letting some of that chaos in. And by the time you ever have your second or third or whatnot, you know that you have no control out of it anyway. So it's interesting when you talk to a mom of one or a mom of multiples, just where they flow along the riverbank, you can watch it go in those different directions.
Well, you just gave me a big aha about what was behind that
Mm,
rigidity for me. And of course, it was, yes, like somebody's going to say, I'm a bad mother. Of course, self-imposed, right?
yeah.
If I don't do this, if I don't feed my child at this right time, then someone's going to see that I'm a bad mother, because deep inside, I don't feel confident. I don't feel like a good mother, and I don't want people to see it. But I have to tell you, Dr. Shahana, by the time number 3 came along, it would be like 2, 3 in the afternoon. And I'm saying to my husband, has he eaten today?
Ex-
So
exactly.
I grew,
Oh, exactly.
it
And
got better.
let's be honest, that's what social media is about. It's taking this and going, look, I'm good, right? Look, my kids are well dressed, right? My kids are in soccer, right? I do it too. Like, give me
Yeah.
the marks, because so much of our emotions comes from this vacuum of needing significance. There's nothing wrong.
Mm.
We all need significance. That's an important part of our internal driver. But I think one of the reasons we crave that so much is we lack acknowledgement. Like, acknowledgement is or the small band-aid. Significance is the hemorrhage. Does that kind of drive? Right?
Yeah.
Yeah, yeah. So
Yes.
and there's nothing wrong with self-acknowledgement. That's not just patting yourself on the back. It's kind of what you just did, looking between my first and my third and goes, oh, I've come a long way. I've come a long way. And that's what I do for my youth. Obviously, they're not parents, but they have come so far in their life, but they get significance potentially through risky behaviors and harmful ways. So if I can prevent the hemorrhage of significance with the band-aid of acknowledgement and say, wow, you made that decision, good on you. You broke up with that relationship, good on you, right? I consider myself not a doctor, but a coach to them as well.
Yeah, yeah, exactly. Yes, I love that you say that, because recognizing that in yourself and kind of saying, yeah,
Yeah.
I came a long way, or I'm doing great at that now. It's so huge for your self-worth, for your self-esteem, because so much of this
Yes.
is self-imposed. It's I'm not
Oh,
worthy. It's all of the self-talk, the
completely.
negative self-talk that we give ourselves.
I call it, are you rubber or are you glass? If your first didn't eat on time, are you gonna, just like my glass here, is it gonna shatter? Like, that's it? And I see this with my youth all the time. Or are you that rubber ball? Like, can you bounce back? And that bouncing back really comes from self-compassion, right? Self-compassion as being 3 things, but one is important, is that kindness, speaking to yourself in that kind voice. It's often that we jump to that, but let's be honest. I know for my youth, I asked one youth one time, I said, you know what, like, what are we doing? I said, do you even like yourself? And he's like, no, many expletives, hate myself. I said, then what are we doing here? Like, so I think the basis for self-compassion for me is self-acknowledgement, right? You need to get there before you get to self-compassion, and then to turn yourself into rubber versus shattering, right?
And we think that that's a lesson that so many people learn in
Yeah,
adolescence, but actually,
yeah,
like, we're into our 30s, 40s,
yeah,
50s, and we're
100%.
still coming to terms, learning it. It's like a cycle that
It's a
continues.
cycle. It's
And
a
sometimes
cycle.
I'm good and sometimes not so good, right?
Well, exactly. And think about that rubber versus glass analogy in terms of who's on your team to help you bounce back. Like, I see this with my youth and the relationships that they're at. Those people are fracturing them, not allowing them to reach their limits or reach their sky. So that's the other piece. You need to think of the connectivity that you have. And for all the moms and the new moms out there, all I can hope is that you have some support system. Like, research has shown, if you have three people that you can call at midnight, then you're way better than any of the followers or likes or anything that you have on your social media. So that's what I endeavor, and that's what I hope for you.
Real people,
Real
not
people.
where I can validate myself on social media,
Exactly.
right? I'm going to post this fake picture of my family having some sort of time where nobody sees it, but we were actually arguing 2 seconds before that picture was taken. And now I'm going to get the likes and validate it. No, it's real people
Real
who you
people.
can call, who can listen to you,
Yeah.
who are there for you. So much
Absolutely.
of that is missing. And
Yes.
so it's about trying to, find that in your life. And it
Exactly.
doesn't have to happen all at once.
No.
It can happen slowly, right? Find that one person. I talk a lot in my community about this thing called the wheel of wellness, which is surrounding yourself with all these different aspects of wellness, because it's never about one thing
No.
that is going to help your IBD.
No.
It's about a multitude of things. And your support system is a huge part of that wheel of wellness,
Of course. Yeah.
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 Yeah. It's
It's
just
your
huge.
hammock. It's the, when I was growing up, my dad would always kind of take their naps in the hammock. And I remember, I kind of think about that sometimes, because it's that feeling of being bolstered, of being caught, of being supported, right? We all need that, but we need to tighten those holes in the hammock so we don't fall through, right? So that's what I
Oh,
think.
I love that analogy.
Yeah.
So
Yeah.
good. Hey there, it's Karen popping into the episode. I want to thank you so much for tuning into the Cheeky podcast for moms with IBD today. The great information that we're dishing out on this pod is exactly the same type of conversations I get to have with my clients every day. And if you're ready to take your IBD healing journey to the next level and move into being the mom you always dreamed you'd be, then hop on over to KarenHaley.com/consult and book your free IBD consultation with me today. Remember, my mom had to be a little bit different and spell my name with a Y. So that's KaryNHaley.com/consult. Now, on our call, we will dive into what you're struggling with most right now and make a plan for how we can work together to help you achieve your big, bold, beautiful, life-transforming goals. No more sitting on the sidelines, waiting for that miracle cure to magically happen. You've got what it takes to do this, mama. You just need a little nudge in the right direction. And I've got your back. KarenHaley.com/consult. And now back to the show. We were talking a little bit about the adolescents that you work with, which made me think of a question that I have about adolescents in general. So in my generation, we never talked about mental health. If anybody had a mental health issue, that was taboo, even more than it is today. It was, no, I don't have that. That's not me. Even if in the shadows, right, in your own life, you're seeing a therapist, you've actually been given a diagnosis. No. But here's what I think is really fascinating. So I have 2 college-age kids, and for as long as I can remember through their teenage years, they would come home and say, so-and-so is having panic attacks. So-and-so has depression. So-and-so is borderline. Like, it's just, everybody has a therapist. It just rolls off the tongue. They just talk about it so much more openly than we did in my generation. So my question for you is, this new way of looking at mental health, this 180-degree turn, is this great? Is this that people are talking so openly about this, or is this a case of TMI?
Yeah, that's a really, really good question. I think it's a yes but answer. So yes, I think once again we've learned through this conversation, whether it be postpartum OCD, IBD, or many other things fall under that category, that shame and stigma breed in silence, right? Nothing good happens when people are suffering alone. We all need a sense of community, hence the social interaction and the importance of that. Okay, wonderful. We know through obviously Brene Brown's work and this idea of the difference between vulnerability and shame, right? So when people can be more vulnerable and enhance their connections. Excellent. So all of that are kind of those tick marks for why we should be talking about mental health. And the way that I like to talk about mental health, it's not a you disease, it's not a me disease, it's meant for all. Meant for all. Mental health is meant for all. Just like I work a lot in breast cancer as well. If somebody was diagnosed with breast cancer and the other person was diagnosed with schizophrenia, studies have shown the person with cancer would get a lot more support because we still take a big step back. So there's still work to come. And there's 2 things to say about that. Number one is that we have tended to use the words anxiety and depression not as diagnoses, but as adjectives. It is okay to feel anxious. It's in fact, just perfectly normal. We have 3,400 different emotions, and anxiety is one of them. Okay. So I think what's happened with our youth is that if I feel really anxious, I must have anxiety. And
Gotcha.
that's the rub. Is it an adjective or is it a noun? Right? So I feel
Yes.
sad, therefore I must have depression. So the great example is I had a youth come to me the other day. My youth worker says I need to go on anti-anxiety medications. Very typical appointment for me. I said, and I stood up in front of the class and had to give a little public speech of some sort, and I felt anxious. So I need
I love it.
medication.
And
So
yeah,
no, like no. So
that's normal.
normal. Like let our anxiety, and there's beautiful books written about this, right? The idea that actually there's nothing wrong with acute stress. Acute stress is why all of us are alive right now. If we didn't have those periods of acute stress, i.e. illness, we wouldn't be able to get over it, right? It's the chronic stress. It's the day in, the day out, the month in, the month out. It's the idea, once again, of the not being able to complete your day-to-day activities, taking a toll on your sleep, taking a toll on your relationships, losing or gaining weight. It's all of that. So I think we have to be, the but part comes into saying there's nothing wrong with emotion. Comes from the word motus, which means comes and goes. Emotions are energy. They come and they go. Anxiety can do that too. But if it's here and here to stay and it's always there 24/7, then we need to talk about it as well too. So we do, I think we've crossed that line quite a bit. I call it the pendulum has swung a little bit in the other direction. And it just
Yeah.
is, the onus is not on the patient. They're doing their sharing. It's on the physician to be the gatekeeper and say, wait a second. Not, I always say, just because you mention it doesn't mean I need to medicate it.
Ooh, yes, very
Right?
good. I like
So
that.
I don't need to
Yep, I
medicate
like that.
everything you say. I'll listen, I'll empathize, I'll be there, but there's not a pill for every ill. So let's just kind of reframe that.
Yeah, yeah. And so by talking to you, then they can kind of say, okay, is this
Yes.
normal? Is this a problem? It's like they're kind of coming to you and saying, this is what happened to me. Is this really a problem? And then you can say, well, let me, you can probe a little deeper and then say, this is or no, really, it's normal.
100%. Exactly.
Getting anxious when you have a speech is a normal reaction.
It's okay. And that probably served you well in that time period too. And the other piece I think is realizing that there, the craving or needing a diagnosis to validate who they are. You know,
Oh, you just said something so important. Please just say that one more time.
yeah,
Because
like craving or
yes,
needing a diagnosis to validate who they are. You are not the alphabet soup after your name. I'll get these teens GAD and PTSD and BAD and BPD, like, wow, like that's a lot. That's a lot.
yeah.
And I,
They're wearing it like a
yeah,
badge of honor
yeah,
almost.
yeah.
Yeah.
So it's that we're walking that tightrope between saying that you are legitimate in who you are. This stuff is maybe part of who you are. It's not all of who you are, but also trying to say is that you are not that, if that makes any sense, right? So
Yeah.
like
You're experiencing that, but
is
you are not
not
that.
that. Exactly.
Yeah.
Exactly. There is a big life for you outside of that. And you don't need, you know, sometimes I'll see these youth who are on 8, 9 different medication. And I'm going, oh
Wow.
my word, like where do we even, and we don't know how anyone's reacting because it's all a soup of medication. So yeah, that's the other thing as well too. So let's
Yeah.
not hang our hat that I'm just waiting for that, for example, ADHD diagnosis, then I can get on with my life. I think we have to be a little bit cautious about that.
Yeah. That's really wonderful. Thank you
Yeah.
so much. I love that you clarified that for me because that makes a lot of sense.
Yeah.
I think the big takeaway here from our conversation is that when you're really thinking about your mental health in whatever type of challenge you're having, whether it's dealing with trauma, anxiety, depression, whatever it is, thinking to yourself, like really going in and thinking to yourself, how much is this really affecting me?
Yeah.
Did this just happen to me once? Or is this becoming a pattern?
Yeah.
And
Yeah.
if it's becoming a pattern, then it's time to reach out and seek some help.
Yeah.
And
Yeah.
so where would that be? Where's the best
Yeah.
place to
Yeah.
go if that's an issue?
And I think I know for so long I would just say, oh, just get some counseling, like as if it's just like, go pick up some bread from the store. I think you have to go. It's once again our job as a physician or whoever the gatekeeper happens to be, whoever you happen to be seeing, to what I call preload the patient a little bit, that the first counselor you see might not be the right counselor, just like the first
Yes.
medication you take might not be the right medication. Don't write off all counseling or all medication or all supplements because the first one didn't work. And I wish someone had told that to me too. You might need to go, just like trying to wear the perfect pair of jeans, it might take a couple of goes too, right? There is different types of counseling. Not all of it is, so you sit there, I talk, you listen, I leave. Like, there's
Yeah.
other things that you can
Yeah.
do as well. CBT, DBT, EMDR, trauma-centered counseling, lots of different things as well. I'm not sure how it works there. Here, there is a cost, which is, most of my youth obviously are not covered for that. Our clinic does provide some counseling, but that's another thing to try to finagle and keep in mind is how to manage the finances, because that can be a serious and legitimate concern for a lot of people as well. And some studies show that not talking to someone who's extremely close to you, whether it be like your best friend but just talking to somebody that you trust, but is a little bit at an arm's length. I know for me, the first time I ever shared my true story was with a colleague, and we happened to be working and charting, and we got to talking, and she talked about her postpartum. I, for the first time, used postpartum OCD. And ironically enough, she turned to me and said, me too. Not that she had OCD, but that she had a
Wow.
very similar tumultuous journey. And it was that moment of leaning in instead of going, oh, I don't know what you have. That's weird. If there's any message I want to take away is that if anybody ever makes you feel that way, do not go to that person. You
That's
deserve
right.
much more than
Right.
that. Because even if we don't have a quote unquote label for what you're feeling, and you don't always have to, there might not be, and that's okay too. But all I want is to you to feel that sense of empathy, that sense that someone is listening to you, that you feel validated, and that you feel heard. So that's what I want. And that's what I think everybody deserves at minimum.
Yeah. So finding somebody who does that for you,
Yes.
keeping in mind that if you decide that therapy is the option for you,
Yes.
in the United States, you can interview. I tell people this all the time.
Mm.
You can do the same thing with your doctors.
Yeah.
Interview them
Yeah.
first. Call, say, can I have a 15-minute consult? Pick maybe 3, and then have a phone conversation
Yes.
with them. Do I resonate with this person? Does it fit for me at all?
Exactly.
And you can do the same thing with your friends. You can, have a quick conversation. Is this, you can kind of share a little bit of the story. And if you
Yes.
feel that they are open to it, if you
It-
feel supported by them, then you can share more. So it doesn't all have to come at once. But
no.
I think the bottom line here is whoever you go to first, if it's not the right person, go to somebody else.
That's right.
That's
That's
what
right.
I hear you saying.
Exactly. And usually, and this is, I always talk about emotional intelligence, emotional learning as not learning, but unlearning. It's unlearning how you've learned to think about yourself, to self narrate to yourself, all of the different biases that have come along the way. So that takes time, right? It's not a one and done. It's not, I've seen a counselor for 2 to 3 months and I'm feeling great already. So allow yourself that this is going to be, it might be 3 steps forward, 1 step back, but as long as you're making some sort of linear progression, I would just try to stick with it. And it's just like exercise, right? We never think, I've seen a personal trainer 3 times. Why aren't I like completely built and ripped? Like, what's happening? Like, we would never judge a personal trainer for that too. So allow the same respect to your counseling professional as well.
Yeah, exactly. It just takes time,
Yeah.
right?
Yeah.
And so, your message is that it sounds like to me is that give it time, right?
Yes.
Know when it's time to get help,
Yes.
but then when it is time to get help, give it time.
No, exactly. Certainly know that you're not alone in all of this. In fact, the one piece what you were saying with your college age boys, which is really important, is to normalize the counseling piece. I know growing up, if you ever mentioned the word counselor, you'd
Right.
be like, what? Like, that's crazy.
What's wrong with you? Yeah.
Now it should be, I go to the dentist, I see the optometrist, I go for personal training, and I go to the counselor. Like, it should be considered just as normalized as all of those specialties too. So
Yeah.
I think if we see progress, it's in the piece that psychotherapy, counseling, whatever you want to call it, is getting much more accepted and normalized.
Yeah, and especially for moms with
Yes.
inflammatory bowel disease, with
Yes.
Crohn's, with colitis. It is a lot. You're a mom and you're dealing with this disease that has it's like we were talking about this earlier before we hit record. It is a roller coaster. There are so many ups and downs. And so to have somebody, and there are specifically trained therapists that can help. There are
Wow.
health psychologists, right? That are
Exactly.
knowledgeable about Crohn's, colitis, about medical
Yes.
conditions, and they're available and can help. So
That's
it's huge.
that's huge.
Yeah.
And that's all you want is, and yeah, you want someone in your corner that actually knows the language that you're speaking, right?
That's right. Yes, you want to feel seen, heard, all of those things.
Exactly. You got it.
Dr.
Yeah.
Shahana, I want to finish up today with
Mhm.
just a little fun lightning
Sure.
round.
Yeah.
Is that
I'm
okay with
excited.
you?
Yes. Yes.
Okay, so yeah, all of the questions promise super fun, super easy.
Yeah.
Some of them are about mental health, about health in general, but it's just going to be fun.
Okay. Perfect. Yes. Got it.
Ready? Okay, let's go for it. Okay, number one. I love this question for you, especially because you are an MD.
Mhm.
So when then you go to the doctor's office, how do you advocate for yourself during visits?
Oh, good. Oh my goodness. Yeah, that's good question. It's a little bit different because my MD happens to be a colleague of mine too. The way that I advocate for myself is actually, for me, I tend to be a little bit overzealous, a little bit rigid. Because I think I know what I need, I tend to take a step back. I'm really working on listening to somebody else for advice. And that's actually worked really well, because being a doctor to your own child or children, I have 3 boys, is not a good idea at all. So for me, the advocating, what I need to work on is to say, what do you think I need to do right now? Instead of always be an overbearing mom, doctor, patient, which I tended to be in the past. So,
That makes sense.
yes.
That makes
Yeah.
sense. What is your favorite form of exercise?
Oh, yeah, for sure. I love weight training. Anything with
Mhm.
lifting is one of my favorite things to do. Yeah, and my husband's really big into it. I think just lifting heavy things. I'm not talking about extremely heavy, but it seems to just release a certain level of confidence in myself. So yeah.
Yeah. I love that too. I started strength training maybe 6 months ago. Love
Nice.
it. I'm so with you on that.
Oh, perfect.
What's one thing that you do on a regular basis to help you connect with your mind, like a mind body technique, a self care hack? What helps you connect with yourself?
Yeah. Warm bath, reading, Epsom salts, usually every day, every other day. Yeah.
Every day.
Oh, yeah.
I
Like, and when
love
the kids
that.
go to bed.
Yeah. Yeah.
Yeah. I don't think it's great for my relationship. No, I'm joking, but like, I'm very much like, can't talk to you, honey, right now. I just need a little bit of that quiet time, a couple drops of eucalyptus. And it doesn't have to be very long, but it's lovely. And for me, reading is my ultimate escape. I just absolutely, and we're talking like chick lit books, nothing heavy here, but
Yeah.
yeah, that's what I love.
Escapism kind of
Exactly.
book.
Yeah.
Yeah. What is one thing that we are all getting wrong about mental health, in your opinion?
That it's like a light switch, that you either have it or you don't. And that's, mental health is not the absence of distress. It's not it's an ongoing thing that we all, just like that personal trainer example. I think when our life is going well, we think our mental health should be going well. But I think it's, mental health is about balancing your expectations times your perception of what's happening. That's the key to mental health.
Gotcha. Interesting. Okay. Speaking of books, when someone says to you, do you have a good book recommendation? What is always that one book, that one book you recommend most?
Yeah, it's a great question. I never thought it. Yeah, Compassionomics. I forget who the author is
I have
actually.
to write that down.
It's really, really good. It's given to me by a close friend, and it actually delivers the science of compassion in our healthcare system. And it's actually really focused on the U.S. healthcare system. But in any case, they really talk about this idea that in medicine, especially, we think of the diagnosis and the treatment as the main dish, and compassion as dessert. And we need to start thinking of compassion as the main dish, because it's not just that it's a nice to have, it's a need to have. People get better, live longer, feel better, even for us, for burnout reasons. So it was what I always knew in my heart. It gave the literature to support it.
Yeah. Oh, I have to read that. That
Yeah.
sounds like a good one.
Yeah.
What are you currently binge watching?
Oh, that's a really good question too. This is a very boring answer, but there's this daytime talk show just called The Social CTV, so I will watch that sometimes. Actually, the Amazing Race Canada. That was just one of those things. It was actually
I
quite
love that. You
a
can cheer for them.
nostalgic show, because I started watching it in the postpartum period, and it was one of those
Okay.
shows that I'm like, that was my little break or my little getaway when I was postpartum, and now I get to watch it with my son. So
Oh, I
very
love
sweet.
that.
Yeah.
That's great. That's great. Favorite travel destination?
Oh my goodness. Yeah. Australia. I've got a lot of family in Australia. I would love to take my kids and go back. I've been just twice too. And Hawaii as well. So
Yeah, yeah,
yes.
yeah. I have not been to Australia. Hawaii, I've been a few times.
Nice. Yeah.
Yeah, love Hawaii, but Australia is on my bucket list for sure. Coffee or tea,
Right?
and how do you
Yes.
take it?
Oh, coffee. Sorry. I was going to say love coffee, but Indian, we have every morning Indian chai tea. So that's what's boiling in the house. My husband has to prepare it and has cardamom and cinnamon and fennel and green tea and with a little bit of milk. So,
Oh, that sounds delicious.
yeah.
Okay, just two more. What is your favorite way to? Oh, I know your answer for this. What's your favorite way to unwind after a long day? It's
Oh,
got
there
to
you
be that bad.
go. Right? Yeah, yeah, yeah. So
Yeah, it's got to
sometimes
be that bad.
I will go for a small walk with my husband just because that is important that we communicate, but that
Yeah.
too. It's nice to have a walk without the kids.
Yes, yes, for sure. Okay, last question. The name of this podcast is the Cheeky Podcast. And so to me, cheeky means being a little sassy, a little bit quirky, and a lot badass. So
Hmm.
how are you cheeky in your life?
Oh, I don't know if this counts as an answer, but do you know what? Did you want? It's kind of going against the grain of what a physician should do. As a family
I
doctor,
love
I
that.
should be seeing, 9 to 5, X amount of patients every day. And I remember going into that room going, I spent 10 years and I feel suffocated and stifled by these walls. And doing this, being a physician, going on podcasts and speaking and not knowing what I'm doing, but doing it anyways. That's
Yes. So good. So good. Dr. Shahana, it's been such a pleasure to talk with you, to hear
how.
all of your insights on mental health.
Thank
If people want to find out more about you, if they want to follow the wonderful work that you're doing, where can they find you?
No, absolutely. So my website, drshahana.com, super active on LinkedIn. So Dr. Shahana Alibhai, come find me there. Hopefully have a book coming out in spring, February, March. So, you can always check that out, but lots of free resources on my website as well.
What's the title of the book?
Feel
Do you have a
better.
title?
Yeah.
Feel Better.
Feel better. Yeah.
I love it.
Yeah.
Oh, awesome. Thank you so much.
Oh, my
Such a
pleasure.
pleasure.
Thank you so much.
Take care.
Bye.
Bye.